Starting April 24th, Texas residents will need to dial 10-digit numbers to place their phone calls rather than 7-digit numbers. By July 16th, 2022, all calls made to 988 in the nation will be directed to the National Suicide Prevention Hotline. This change comes after suicide claimed the lives of over 48,000 Americans in 2018, resulting in about one death every 11 minutes.
I mean, if you can call 911 for a crisis, there should be a similar three digit three digit number that you can just dial in for a mental health crisis, especially because that is such a vulnerable state and people need help immediately. Like mental illness is very, very detrimental. And especially with COVID, people have been struggling more and more and they don't know where to turn. Having that kind of resource would be invaluable.
In the past year, the prevalence of suicidal adults in the United States, ages 18 to 25, was at 11.8%, the highest percentage amongst all other age groups in the nation, according to the National Institute of Health. Third year UIW medical student Pratusia Pila says having a 988 hotline for mental health crises will be beneficial for university students.
There are statistics showing that there are higher rates of mental illness in people who are in college. And with COVID, we're going to have to wait for the studies to come out, but it seems like those are skyrocketing just from, a clinical perspective of seeing people during psychiatric rotations and just anecdotally knowing people. So having that kind of resource more readily available would be beneficial, but making it more difficult for people to dial in would be detrimental. Like so many of us go to college outside of our hometowns and we don't readily have family accessible to us. So making it a situation where young people are struggling to find help and have to work harder to find help would be catastrophic. But having a three-digit number that you can dial into that like 911 that's at our fingertips, I think that would be enormously beneficial and it could save lives.